Diastasis recti is a separation of the main abdominal muscles. So there is connective tissue line in between the two long muscles at the front of the abdomen, and that gets stretched during pregnancy, particularly at the later stages of pregnancy. You're more likely to have diastasis recti if you've had multiple pregnancies. So it's important to understand whether you have diastasis recti, this gap, and a lot of people don't actually know whether or not they have it. Many of the times it'll actually heal itself and knit back together, but for several women that doesn't actually happen naturally. So what we're looking for is more than a kind of a 1 to 2 finger width separation horizontally going down the front of the abdomen. You may find that you have 2, 3, 4, even 5 finger width separation distance, and that's really important to understand whether or not you have that gap, because you're going to need a specific exercise routine and you're going to potentially need to see your physiotherapist. But it's really important that you don't start doing certain exercises. So for most women who've had their babies, the temptation is, I want to get rid of my belly, the little pooch that's hanging out after you've had your baby, whether that's 2 months, 8 months, 5 years afterwards. So it's really important that you don't start doing crunches or sit-ups or like full planks, because that's putting a lot of pressure onto those muscles. So you might find you're exercising for months and months and months and nothing is happening, and actually you're not doing anything to heal that big gap in between the abdominal muscles. So it's really important. So today we're going to do a really simple test. It's not a diagnostic test, but it is an indication whether or not you can continue on with your normal exercise routine. If you have, 1 to 2 finger width distance gap apart is fine to continue on your normal exercise routine, but anything more than that is when you need to start paying attention. So we're going to do the simple test now. We're going to lie down on our back with our knees bent and the heels coming towards your bum, and I'll see you in a minute. Okay, so let's see if we have this gap in between our abdominal muscles. I'm just popping my top up here. So we're going to get 2 or 3 finger width and take the other hand behind the head, and we're pressing in a downwards direction, about 1 inch or so, 1.5 inches above the belly button first of all. So you want to take a breath in, and as you exhale, draw in the tummy muscles. So you're switching on those tummy muscles, and just lightly lift the head. You don't need to lift any more than that. And you're trying to press down for a gap, a gully, like a valley space in between the 2 long muscles running down the front. Okay, so you might have 1 finger, 2 fingers, 4 finger width apart. So you're pressing down, trying to measure that as to give you a rough idea. Then rest the head back down, relax, and then you can move below the belly button then, and it's the same thing, okay, 1 inch or 2 below the belly button. And you take a breath in. As you exhale, pull in those tummy muscles and lift the head again. So again, you're pressing down, trying to feel a bit more, maybe a bit more of a gap, a bit less of a gap down here. And then when you think you found your gap and measuring how wide it is, you're going to rest back down, take the hand out and relax. Okay, so that was just a really simple test, remembering it's not a diagnostic tool, but it should give you an indication of whether or not you have more than 1 to 2 finger width distance apart between those 2 abdominal muscles. Just remember that if you do have more than 2 finger width distance gap between the muscles, really you should be looking at a specific exercise routine to help those muscles knit back together, or go to see your physiotherapist, because if you leave them untreated, if you like, it'll just mean that you could have a lot of back pain and other pelvic and core and internal issues. So we don't want that. So we want to think about strengthening and getting those muscles knitting back together again. So today we're going to go through 3 exercises that will help you with the diastasis recti, so to help heal and close the gap and make that you feel just so much stronger within yourself, within your core.
So the first thing we're going to do is a knee fall out. So we're going to take the feet together, and really you're placing your hands on your hip bones and moving one knee out slowly to the side while you're kind of trying to keep your other knee as still as possible. Now, with all these exercises, these are core exercises. You are hugging your tummy towards your back of your body. So you try and relax your shoulders, but you're bringing all of these exercises through the core, and that's really important. You're not just kind of flinging your leg out willy-nilly. You're bringing very controlled, and you should be trying to feel your big transverse abdominis, your big deepest core muscle. So you're keeping that sensation of hugging your belly towards your back. The next one we're going to do is a second one, mini pelvic tilts, and the same thing, our feet are about hip width distance apart here, and you're this is a tiny movement but really focused. So again, you're drawing your tummy muscles in, and as you do that, you're just tilting the lower back towards into the ground, if you like. So they're very tiny little pelvic tilts, all very much from the pelvis. So your hip bones are going up towards your rib cage in that general direction, but you can see from the video they're very tiny movements. With all of these movements, you want to try and aim for 10 to 15 either per side or per movement. And the next one we're going to do are toe taps. So very important here to engage again through the core, and then feel nice and strong, and bring one leg so that the knee is directly on top of the hip and return to the floor, and then the following knee directly above the hip and down to the floor. So you're doing these alternating your legs one at a time. Again, you should be able to feel your core tummy muscles working here as you rotate from one leg, but don't bring your knee closer to your chest. Okay, you just want your knee bang on top of your hip. Okay, so the hip bones are nice and still. You're breathing and nice and controlled, one knee at a time.
So if you find those a couple of exercises fairly useful, you can go on to NurtureMamas.com, and I have a full program on there which has 10 or 11 progressive exercises that you can practice. And those 3 were a snippet of some of the ones that you can practice. So there's a course called Diastasis Recti Restore program. If you go on to NurtureMamas.com, and then the top right there are online courses, and yes, and it's €28, and you can, once you buy it, you can log in and do repeatedly at your own pace, as often as you want to. So I'd really recommend, if you do find that you have a gap, and you find some of those those exercises useful, that you go on to the full Diastasis Recti Restore program.